Good day, everyone. I'm Camille, and today we're going to look at the medical technologies stay in the lab. Let's go inside. Hi. Yes. Good. Can I ask you a couple of questions? Oh, sure. Get inside. What are you gonna ask? So, what's your name? Oh, I'm Shimea Gutierrez. What's your profession? I'm a medical technologist. So, can you describe your role as a medical technologist? Okay, as a medical technologist, we process the patient samples like blood, urine, and other body samples. So, what daily responsibilities do you handle that directly impact patient care? We actually assure the accuracy and the precision of the patient samples in our daily job here in the laboratory, so that when we submit the results, the data to the doctors and nurses, they can easily treat the patients with the right treatment. How does your responsibility complement with other allied health professionals? So we provide the clinical data with the clinical judgment, and the nurses, they provide the patient care bedside, while the doctors, they synthesize the data that we give them. Your experience, what makes interprofessional collaboration effective? With the collaborative work of the healthcare workers, I've seen there's effective and efficient way of treating the patient. How do you ensure accuracy and minimize errors when working with you? Okay, so that's easy. We make sure that the controls and the calibrations of the machines are in their right positions, and we make sure that there is a quality assurance in the laboratory. What challenges do you commonly face when collaborating with other healthcare professionals? Miscommunication. That's why direct communication is very crucial in our job. So how do you handle those challenges? We directly call them through phone and ask them about the patient details, so that actually we do it as soon as possible, so that there will be no delays in processing the patient samples and releasing the results. Can you share a situation where teamwork prevented an error or improved patient outcomes? For example, here in the laboratory, we process hemotech or hemodialysis samples. So whenever there is a critical level of potassium, let's say beyond 6.5, we inform this to our chief medical technologies, and then when they confirm na dapat i-relay yung results doon sa hemodialysis centers, we directly communicate to the nurses, so that they will be informed about the result of the patient immediately, and then we release the results ASAP.
In the first part of the interview, Ms. Shamay Gutierrez, a medical technologist since 2019, highlighted the vital role of medtechs in ensuring accurate and timely laboratory results. It emphasized how effective communication, teamwork, and strict adherence to protocols strengthen collaboration among healthcare professionals. Despite challenges such as miscommunication and workload pressure, a shared focus on patient safety allows the team to work efficiently. Now, let's proceed to the second part of the interview.
How does being part of the healthcare team helps improve the patient's outcome?
So when everyone collaborates, the nurses, the doctors, and the medical technologists, the patients, our patients, they receive a safer and more efficient and holistic care.
So, in what ways do you contribute to the patient-centered care, even if you don't have always interaction with them?
Well, even behind the scene, we make sure that we handle the samples correctly, We make sure that the information of the patients are are correct, and we make sure that there is accuracy in the results that we give the patients.
How do you uphold professionalism in the team setting?
Well, we practice accountability here in the laboratory and honesty in reporting in the results. And of course, there is respect among our colleagues. It should not be missed.
Aside from that, what technologies do you use that help improve communication with other healthcare team?
Okay, so here in the laboratory, the clinical setting, just like how we use the messenger, like how we use the phones, we use them also to directly contact other healthcare workers and the nurses about the patient results.
How has technology changed the collaboration between medtechs and physicians over years of practice?
Before, when everything is still when everything was still manually done, um, there is a longer period of processing the samples, and of course, there is a longer period of releasing the results. Now that we use technology, there is faster way of releasing the results.
I would also like to know if are there challenges that using technologies affect teamwork and how do you manage them?
Okay, so one of the encountered errors here in the laboratory are the system downtimes or information backlogs of the machines. So, as much as possible, we check if we can troubleshoot the machines on our own. But if it's beyond our ability or capability as medical technologists, we call the engineers of the machine.
In the second part of the interview, we learned how interdisciplinary collaboration and technology enhance patient centered care. Ms. Gutierrez emphasized that even without direct patient interaction, medical technologies contribute significantly through accurate, timely results, professionalism, and quality control. The use of technologies such as laboratory information system and electronic medical records improve communication, reduces error, and supports faster clinical decision making. These insights directly apply to the practice of medicine as they highlighted teamwork, professionalism, patient safety, and effective use of technology as essential components of high quality, patient centered healthcare. Now, that is all for the Practice of Medicine interview of an allied healthcare professional. Thank you so much for watching. Merry Christmas and goodbye.